Hi everybody, this is a quick video about one of my favorite topics, biofilms. Just before I jump into the video, if you wouldn't mind taking a quick second just to like or share or subscribe or post a quick comment on the video, I'd really appreciate it, so thanks in advance for that. So someone posted a comment on one of my other videos, one of my other biofilm related videos, saying something to the effect of, it would stand to reason that you'd start with a phase 1 biofilm disruptor and then graduate to a phase 2 biofilm disruptor. And that is very logical. However, it wasn't actually a question, but I just felt the need to comment in video form on that statement, that I don't typically actually do that in clinical practice. In clinical practice, and as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to obtain that advice. In my practice, I usually don't bother working with phase 1 biofilm disruptors except in rare instances. And the reason being is that phase 2 biofilm disruptors will break down phase 1 biofilms. And so my rationale is I'm going to just, when I'm ready to go after biofilms with my patient, I will recommend that they start on a phase 2 biofilm disruptor, start at a really low dose, build up the dose fairly gradually, and we just go from there. And if they start to have a flare, then yep, we'll back off on the dose. We'll just stop the biofilm disruptor, make sure we have our antimicrobials in place to deal with whatever came out of the biofilm, and then once the flares settle down, we start them back up on the biofilm disruptor. And that process, generally speaking, goes very smoothly. There are some rare exceptions to that, but generally it goes smoothly. And generally using that approach, I don't really see a whole ton of flares very often. Now, if I had a patient where we are using that approach and even at a very low dose, they were having notable flares, or I was working with a patient, we were using this approach and they found that they were having a hard time building up. They'd be like, starting with their starting dose and flared a bit, and then things settle, they're tolerating that dose and they increase a little bit more and they flare again and that settles, and then if we increase a little bit more and they flare again, it just looks like it's just going to be this really unpleasant flare-filled extravaganza, happening. Then that would be one of the rare instances where I might say, okay, let's switch to some phase 1 biofilm disruptors. Maybe let's work on that first, and hopefully it'll be an easier course of things. I mean, to be perfectly frank, I'd probably switch to a different phase 2 biofilm disruptor prior to going down to a phase 1 biofilm disruptor, but usually it's well tolerated and it's not a problem. So not that it would be wrong to do a phase 1 biofilm disruptor first and then phase 2 afterwards, but I just don't typically do that. I personally find, from my extensive clinical experience around biofilms and whatnot, I don't really find that phase 1 biofilm disruptors oftentimes do a whole heck of a lot. I find that when folks come in, they're oftentimes taking things that have phase 1 biofilm disrupting properties to them. It's rare that they've caused any flare-up symptoms. It's rare that they've really moved the needle in an obvious way in the right direction. And so I don't really feel like they have a whole ton of clinical utility, at least in my experience up to this point. Now, I have certainly had some patients where if they're on a phase 1 biofilm disruptor for long enough, especially at an appreciable enough dose, then I have seen cases where I'm convinced that we're actually seeing some excessive phase 1 biofilm disruption, and it's causing them to flare up because it's breaking down biofilms prematurely. I've primarily seen that when folks are using essential oil-based nasal sprays, which essential oils have these aromatic compounds, which are phase 1 biofilm disruptors. And given enough of that, I have seen some cases where I'm quite convinced that they are breaking down biofilms excessively in their sinuses. But that's also very unique compared to like, oh, I'm going to take my nattokinase, or I'm going to take my serrapeptase enzymes, or I'm going to take my herbs that have aromatic properties to them that are going to be breaking down phase 1 biofilms more systemically. It's a lot different. Spraying essential oil nasal spray or diluted essential oil nasal spray into the sinus cavity, it's a very small area relative to the entire body. The enzymes getting into the bloodstream and this and that, it's going to be a much less concentrated exposure to those phase 1 biofilms compared to a nasal spray. So anyways, it wasn't a question. So normally I would say, thank you for the question. It wasn't a question. Thank you for the comment. That's the right thing to say in this case. So thank you for the comment. It spurred what I felt was an interesting video that I enjoyed making. So glad that this happened. Thank you for your attention. If you have any questions about this topic or anything else, just post in the comment section below and I will answer as soon as I can.